Hi, everyone. How's it going? A beautiful day. It's Sunday, the 12th. Good morning. Let's see, SHM17, T Sweet. How are you doing? Winsome Escobar. Good morning. Judy. Good morning. Good morning. Good morning. Sunday. Let's see. A beautiful day upstate New York. I was out in Colorado Springs the last couple of days. Really awesome. Dr. Magarelli, Dr. Fink, and the entire amazing CNY Fertility Colorado Springs team, the clinical team, the OR team, the transfer team, the everyone team, the cleaning team. Just really, really grateful for all the amazing things they do. I have a question. How much should I drink during stims? Well, you don't have to hold back. You don't have to overdrink when you're thirsty. Drink water. Water, water, water. A little bit of tea, a little bit of coffee, mostly water, and stay away from alcohol. But that this measurement of how much should we drink, we know we should drink breathe lots of air, and keep some water by your side and drink it. Trish, how you doing? Vanessa, Andrea, good morning. Happy Sunday to everyone, by the way. And every day we have to have faith in this higher power that's guiding all of us, no matter your belief in God or not, spirit or not. And all of us are on this journey together. Alexandria Lupo, hello. Shiri Mapsalat, how are you doing today? Let's see. Antonia, good morning. Marlena, good morning to you. I have the new Keto Magazine coming out. It should be out on our website, resources, and also on Amazon. And so I'm excited about that. And Maria Emmerich and I have a cookbook coming out. And I think if you go to our website or Maria's website, this isn't a copy of it, and don't forget, Maria does a lot of non-carnivore stuff, and we support vegans, vegetarians, everyone out there, and learning to do things differently, trying for a miracle, doing for a miracle, and keep going, don't stop. Tyler and Mary Fry, how are you doing today? I've got my my YouTube slightly this way, and Facebook, and my Instagram over here. So if you see me kind of looking over here, I've got my things to read over here and over here. So let's see. Mrs. Giffen, third FET, not modified natural with the trigger. Unsure if I need to include immune meds like Prograf, Plaquenil, prednisone. I usually say yes. I do. I personally prefer the Plaquenil over the Prograf. Prednisone, at least 5 milligrams twice a day, but I think going to the 10 twice a day, or even 15 in some cases. The intralipids weekly, Lovenox once or twice a day, Plaquenil once or twice a day, the prednisone twice a day, and don't forget keto. Keto is a high fat. I say kiltz is keto, is high fat, one meal, cook the carbs well, or eliminate them altogether. And I know it's hard stuff, but anyone can do easy. And we're working on something that's hard, and we're getting all the inspiration we can from everyone out there. Fertile Hope Yoga, the Fertile Spirit with Danielle. Check her out. Check the team. We're working to build our fertile friends that we can all get lots of support. 04 Boss Lady, how you doing? Effie, Prissy, Sharp, hi. Let's see, excited here. Opening in Florida, Sarasota, Dr. Condorp's down there. I may be going down there this week. I'm just checking to get things moving along, getting our IVF lab started to be constructed. So we're excited about that. We will be doing ultrasounds and blood work and monitoring for either Colorado, Buffalo, Syracuse, or Albany retrievals. We're working on wherever you're located, finding an OBGYN that is friendly, or an REI that's friendly to helping affordability, quality, and access, and integrating Eastern and Western medicine, by the way. Any first success with IUI, does it usually take more than one cycle? Let's see, and Tanya, it may just be the one. And just visualize that this is the one. I'm getting it in this one. Don't give up. Always keep at it. And if it's not working that time, it's meant to work the next time. And just keep on going for sure. Let's see, Hannah. Let's see, 92014. hypothalamic hypogonadism be passed down to a daughter? It could be. All of these things have genetic predispositions, maybe environmental factors, but it is ways of treating that and helping people with hypothalamic amenorrhea, hypogonadism, because we simply need to give LH and FSH to stimulate the ovaries or the testicles to make eggs or sperm directly, by the way. Good morning, Shar. How you doing? Jesse Rosado Floyd, transferring 5cc high-level mosaic. We have to be careful about how we grade or test any embryo, any sperm or egg, or any of us. But every egg, sperm, and embryo has an excellent chance of becoming a normal child. And I've seen the fact that, back to my soccer ball, is that depends where you biopsy the embryo, which is not the fetal pole, by the way, which is not the actual fetus. We can be missing the fact that the fetus is completely normal. So I absolutely believe that a 5cc high-level mosaic has an excellent chance of becoming a baby, just like an untested and just like a normal embryo biopsy outcome that may not implant or may miscarry. So there's so much we don't understand. Recently won the Fertile Grant. Awesome, Elizabeth. And everyone, remember, we're working to keep it affordable with great quality access and integration. Don't forget to check out the Family Building Guide on our cnyfertility website. You can download a digital copy or get a paper copy on Amazon. And there's so much we're all learning together. Bring your new ideas to us, things that we would not believe in or haven't believed in. And Western medicine is slow to change and be open to new and different things, by the way. And by the way, I do recommend the COVID vaccine. But again, each and every one of you have to decide for yourself. We're here to support you. Let's see. Dino Vallis, let's see. How are you doing? Let's see. 27 PCOS, 3 miscarriages, 1 ectopic, transferring 1 or 2 at 27 years young. I recommend transferring 1. Don't forget to look at the full immune protocols. And now let's see. It's on page. It changes depending on which copy you might have. But 73 has our immune protocols, and I recommend immune 3 and 4 for almost everyone. Don't forget, IVIG really helps reduce the floating antigenic antibody abnormal interactions. And Pregimmune with Dr. Vidali, we're working to get that also a game changer where you can screen for your immunologic factors or failed implantation factors. So that's coming very soon. Excited about it. Pregimmune with Dr. Vidali, and that'll be coming very soon. Amanda Werner Perry, what if the embryo is missing 2 chromosomes? Would you transfer a normal embryo? Again, the biopsies that we're taking may be incorrect. That's one of the things you have to understand about all of these things. Dr. Corley, hoping 1 takes. I think, again, no test in medicine is 100% accurate to tell you black or white, unfortunately. That's the challenge to all of this. Lovenox, don't forget, Lovenox, Plaquenil, prednisone, weekly lipids, keto. You may also look at the antihistamine, the antimicrobial protocols, which are either a week up to 4 weeks of antihistamine, antimicrobial protocol. And don't forget laparoscopy, hysteroscopy for endometriosis. Doing the ERA or the ER-Peak, which are 2 separate ones through iGenomics, 1 through Cooper. All are additional tests that you may choose to do. Lovely Gezi, hello, Casey. Nikki Barrel, Barra, sorry if I'm mispronouncing. They go fast. I'm a little slow. By the way, PCOS, polycystic ovarian syndrome, metabolic disorder, prediabetes is rampant in all of us in one way because we're eating 3 to 6 meals of mostly carbohydrate, which is deadly, and complex carbs are not good for us. Simple carbs from time to time, I think, have less inflammation. That's why I talk about kiltz's, bacon, eggs, butter, beef, ice cream, intermittent feasting, and salt. And my ice cream recipe, just Google kiltz's, Dr. Kiltz's ice cream recipe, but you shouldn't have it every day. Let's see, baseline material lining was 8. It's always thicker, but it was thicker normal for baseline. Thicker is okay. These are just And I'm working with my team. Baseline, even if it's an 8, get going, because by day 12 or 14, it's going to be a 12 to 16 triple lining. It's good to go. So really working with my team that we don't cancel because they're a little thicker. We may do a modified natural or a letrozole trigger cycle or simply a natural. It works wonder. But it may be you need Lupron or Orilissa for a month, really thin it down, a hysteroscopy DNC. But it's kind of a crazy concept, but my team is listening and we're sharing with them. It's a baseline. It doesn't say you can't or must. It says, okay, here's where you are. Let's see where you are in a week or 2. Because even if I cancel it, I'm waiting till next month. I might as well do something where I can see what it looks like in that next 7 to 14 days, usually about 10 days, and go forward from there. Sue Owl, OMAD be appropriate. 1 meal a day at night is my game changer. Did hormone profiles, how to read which stage each hormone. I think all these reading these hormone levels is not very accurate, by the way. If you're not getting pregnant, you're amenorrheic, you're likely not ovulating. Clomid or letrozole. I don't love Clomid, mostly letrozole. Ultrasound monitoring, a trigger shot, Avidril, Pregnil, Profaci, and Novaril. And by the way, on the low dose HCG, we may be strictly ordering a 5 to 10,000 of HCG and giving you some new instructions on mixing and injecting it. So be open to change. Coming. Low dose. Natural letrozole Clomid or letrozole with low dose injectables, mini, lower cost, great outcomes. And we all need to be, all of us docs and practitioners on the cnyfertility team, recognizing lower is better. Acupuncture, keto, and cutting out gluten and sweets help PCOS. Anidra, Marie, yes, it absolutely does. Again, look at Kiltz's, Dr. Kiltz's keto for lifestyle for fertility. It's coming out. Check our website. Go to drkiltz.com. Really excited about it. These ideas are not new. They're ancient. And we should be eating the one meal we probably have been eating for thousands of years. We did not have access to 3 to 6 high sugar. Remember, lettuce, fruit, fiber, vegetables, seeds, and nuts are sugar. Sorry. And the plants are the predators that want us not to reproduce. That's the craziness. Baby dust, Samantha Paul, Amber, yes, fresh. Don't forget, add the Lovenox, higher dose prednisone, add the Plaquenil. We don't like to mix the Plaquenil and the Prograf. So you can start the Prograf beginning of the cycle and switch to Plaquenil when you're pregnant. And a lot of these things, again, it's all about inflammation. All disease, I don't care what disease it is, it's simply inflammation. And we're treating inflammation. I learned from Dr. Beer, Dr. Braverman, Dr. Vidali, Dr. Kwok Kim, but mostly I've learned myself because I too suffered. And the moment I eliminated all this stuff, bingo, game change, amazing. Hey, Cheryl, how you doing? I hope to see you and Brandon down in Florida. We're gonna really continue on the journey, sharing with everyone. Just continue, all of us, sharing good baby dust, good love, faith, and patience in the process. Let's see. Sue Al, again, my pleasure. Accept insurance, Georgia. Son, yes, we accept insurance. We're also the most affordable self-pay. We'll be glad to bill your insurance and do our very best, but please make sure you know what your insurance covers and doesn't cover. We're really working lower dose protocols. Dr. Chang, Dr. Magarelli, Dr. Fink, Amy, all of my team members. And listen, I'm not picking them out other than I love them all, but lower dose protocols are really amazing. Let's see, Kaylin. It's a necessary to do Prograf and Plaquenil. I recommend one or the other, not at the same time. It's not necessary to do any of these things. But if you're not getting pregnant naturally, and our doctors are saying, oh, it's just PGS testing and that's all you need, tell them, Dr. Kiltz says I need the immune 3 or 4. You may choose not to do it, But all of us, doctors, practitioners, all of us, look at the family building guide. We should have it, in our back pocket, on our devices. It's so easy. Again, they're on. You could download them on our devices, and we're making better ways for our self-pay, our discounted plans. Again, our $39.95 IVF is the least expensive IVF, and that's our cash discounted. If you want to finance it, it's going to be more, but it's still more affordable than anyone else. We integrate all of these different ways. Best way to avoid a miscarriage with FET, Pcos, Sarah M. McMahon. Let's see. So, look here. It's always the immune protocol, and stay on these immune protocols to at least 12 weeks. Stay kiltz keto throughout your pregnancy and throughout your life. These ideas are game changing. We are lionesses and lions. You may choose to eat as a vegan or a vegetarian. That's fine. But one meal a day, increase the fat, cook the carbs, and variety is deadly for all of us. That's the crazy. Narrow as an arrow will hit the target, and have faith first. Right here, guys, gals, all of us. Faith. Faith trumps facts and spirit over science. You don't have to believe in God, but believe in yourself and the outcomes you dream about, and they will be that or better. But remember, worry brings about what you worry about. This won't happen. It's no good. It'll never happen. It's all a dream. And check out Tony Robbins, Eckhart Tolle, Deepak Chopra. Oh, let's see. The infinite numbers of people. I love to read James Allen, Joseph Murphy, and The Mind is the Master. And don't forget the Christ-Based Teachings by Don Curtis. You might find it interesting. It's only philosophy. You don't have to believe in those religions, by the way. There is nowhere to sign on to the center to treat. What do you does it mark signed when I view it? Help consult in 10 days. Sarah Grazia Pleen. You know what? That's a good question. I don't know that answer. You can email me at rkiltz@cnyfertility or text me 315-416-9872. I'm going to do my best to get some answers. I get 30 text messages and emails a day. I can only do so much in my day. I must get my rest. Very critical for all of us. Kelly Connor, yes, it's in the mind. The mind is the master for all of us, and I'm having a baby. I'm successful. I'm living my best life. Move forward with that no matter what you're suffering from, because suffering is strengthening. And whoever you are, just know that you are all a child of God, and God is within each and every one of us. Wow, crazy concepts, right? So again, we're working on our financial team is working better, more. We're adding new team members. We want to add more clinical team members. I just visited our Colorado team. Oh my gosh, they're doing amazing. All of the nursing team members are doing amazing, and I'm grateful for all of them. So keep moving forward. My team, thank you for being patient with every patient and listening to every one of them. And our job is to ask simple questions and learn from you guys. You guys bring us so much. It's really amazing. Let's see. Nanny D, I'm here to help you. My job is to be everyone's doctor one way or another. I'm working that Dr. Maggs, Dr. Fink, Dr. Corley, Dr. Chang, Dr. D'Souza, all the doctors and all of us work to bring a similar ideas and philosophy for everyone in this. Oh, we work with Dr. Brandeis down in New York, Dr. Ivanov in Philadelphia. We're working with so many on improving these things. Plaquenil overprograph, Mrs. Giffen. Well, we all have our little biases. Plaquenil is used for arthritis, psoriasis. It's an anti-inflammatory. I just think I like it a little bit better, but I do the switcheroo, and occasionally we'll do both, but there's a little bit of interaction that has some cardiovascular risks that we have to be very, very, very cautious of. We lost one of our patients recently after delivering a baby, and we're sending prayers to families and babies, and the suffering is immense, and we're all working together to pray for each and every one of us beautiful, loving journey. And we know that is not easy. So don't give up, and always pray for each and every one of us going through this, by the way. Let's see. Dole Whip Nanny. I'll be with Dr. Corley and Dr. Banerjee in Syracuse. I do have surgery in the afternoon that I'm performing, so I'm going to do my very best for everyone, by the way. Prepare for retrieval. I have mine in tomorrow with Dr. Chang. Jamie, Dr. Chang, tell him hello. Awesome team over there. And let them know if you want to do a fresh transfer, you want to add the immune protocol 3 or 4, and what other things can you do to make this journey better. Keto, keto, keto. I should say kiltz is keto, kiltz is keto, kiltz is keto. And I know, remember, vegans and vegetarians I support. I personally work on a mostly carnivore. I went to Lemongrass last night. The beautiful French fries. I had a little bit of their lobster, some oysters, and a little bit of ribeye. Amazing. And if you go to the Lemongrass in Syracuse, ask for Kiltz's ribeye cut. It's amazing. And it's great for 2 or even 3 people, by the way. Next 2 weeks, any specific foods to eat, prep, post-transfer. Look at, again, go to Dr. Kiltz and look at our new Keto for Fertility lifestyle. In my opinion, it's always keto. I don't care who you are, whatever you're suffering from in life, fertility or not, it's always keto. Call, let's see, Neto. Let's see. I was told during my WTF call, THQ. Not sure what THQ is, and I apologize. Nemi. Let's see. What form of CBD to recommend? Full, broad, isolate. It should be no THC. By the way, CBD, omega-3s, our molecular fertility has an omega. We're working on getting a new CBD back out now that things are opening up again. Sophie Brown. All right. A baby boy. Do I transfer my low-grade embryo 1-4 I have left? Yes. Look at I wouldn't have been transferred if they tested me and then said, hey, do you want this little embryo? Not so good, tested bad. And thankfully, my mother would have said, oh, of course I want him. I'm always talking to Maria and Ray. They talk to me every day. They pat me on the shoulder, tell me it's all okay. Transfer with him. I love Dr. Chang. Awesome. Dr. Chang, we love. Ask him if he's doing Kiltz's keto, by the way, and how it's making him feel. And we're all learning together. Priming, HGH, estrase prometrium, forget ethinyl estradiol. Dr. Chang, throw it out. And simply stim and retrieve, stim and retrieve, stim and retrieve. Dr. Condrup got the twins. Awesome. 7 weeks. We're excited about Dr. Condrup. I'm going to be working also in Sarasota, working with the team. They're very, very, very excited. Lots of patience. Let's see. Do I transfer embryos that keep having too many chromosomes? Stop testing. Transfer. They test me. They throw me out. No testing. Transfer. Testing is all about testing is too much judging. Judge not lest ye be judged. Judge with love and perfection. That's how I recommend it. Would prefer to transfer in a uterus without adenomyosis than my uterus with adenomyosis. Orlis letrozole for 2 to 3 months at least. And yes, I've done many transfers with people with adenomyosis and they have babies. That's why I would think about 3 months. Think about a laparoscopy, hysteroscopy, get rid of the endo also. Kiltz is keto, kiltz is keto, kiltz is keto, 1 meal at night, and have faith and don't lose the faith. And we also work with surrogacy and carriers if that's what you need, and we'll do that also. Don't ever keep the faith, ever keep the moving, ever keep love in your heart. And remember, it's all a dream. Jordan Chang, hi, antagonist with luteal estrase priming, 300, 225, stim 11, style 1200, no eggs. Should I give up? Never give up. Go down to a low dose protocol, human growth, maybe. Don't give up. Kiltz is keto, kiltz is keto, kiltz is keto. For me, carnivore is kick-ass, the most amazing. But if what you're doing, you got to trigger with HCG, by the way. And the 300, 225, I don't know where we get it, but I would say 150, 75 or a 220 of gonal or follistim and HCG. And don't forget the human growth, 3 to 6, 3 in prime, 6 in stem. And LDN helps with, don't forget, low-dose naltrexone. Google LDN, by the way. And I'm appreciative to everyone for sharing these ideas. That's how I've learned them, by the way. Pregimmune with Dr. Vidali, we're going to be offering lower cost testing for immune testing and helping you understand why immunology is actually the foundation of all disorders, all diseases, and all struggles. Let's see. I have to put IVF on hold for a detached retina. Should I keep up the immune protocol and prime for FET while I heal? I think so, but you need to talk to your doc. But prednisone, I think, is okay. This is where keto, low-dose naltrexone. The HGH might be one you might hold off on and talk to your doc. Amber Charlton, when does SH usually go away? I'm 12 weeks and 2 days, since 5 weeks. It usually would dissolve in the 12 to 18 week time frame. This is where inflammation, all the little seeds and nuts particles that we eat in our diet get under the placenta and they cause inflammation and separation. I didn't do the kiltz keto, had 2 embryos. Sadly, both failed. Second time around, I followed keto. I have 19 beautiful day 5 and day 6 embryos. Amazing, Samantha Paul. Listen, these ideas don't make sense and didn't make sense to me until I personally did them. I healed up. All the bowel bleeding, arthritis, psoriasis, kidney stones, and migraines were away. And I will tell you, this is the game changer. Do something you don't believe in to get to someplace you believe you want to be. Because if what you're doing isn't working, you must be the game changer. JL Sosin, hi, 44 years young. I was too sick from mold disease to try earlier. Well, mold is in the foods we eat. Started carnivore. Stay optimistic. Do not lose your optimism in life because you're alive. You're alive on a journey that is hard, stressful, challenging. And the real trick is to know that God is within each and every one of us. Never, ever, ever give up the faith that God is with you. And you and your dreams and your beliefs create God. And to me, God is the most amazing invention that humans have ever created. But it's not invented. It's a known entity that we are all that which we believe in. All right. Different prep for frozen instead of fresh. Let's see. And way page. It goes. So it could be both in the same. Again, if you go back to my family building guide, page 73, right around there, it's either a natural cycle, letrozole trigger, or even a trigger shot that's going to be low-dose gonadotropins or estrogen, progesterone with an immune protocol. Yes, they do work. And again, if it's not working yet, do something different. If you need a gestational carrier, that might be what you need. I never know. We don't know. We're only doing things in life to get to where we want to go. Game change. And if you would like a prayer when we do an IUI, a transfer, retrieval, all of our practitioners are open to a prayer. And it's your prayer, but it's our energy, all of us together through the vibrational energy of our minds that connects globally and universally. We all need to be practicing that each and every day. Let's see. T. Shaw Davis, cycling lining, not wanting to get past 6. Any suggestions? This is where Neupogen wash, PRP wash is early. You might try a natural cycle. This is where human growth early on throughout keto for sure. HCG, I'm sorry, PRP, HCG, and Neupogen washes. And don't forget the Viagra may be helpful. I am Valerie Renee. Valerie, God bless you. We love you. Check out Valerie Renee's channels. Really some great stuff, and we're all sharing together. Let's see. Me, Valdez 32. Thanks for joining us. Don't forget, Dr. Verdialis, we love. She's helping do reversals and surgeries. Dr. Montalto in Albany, we're working with him. Bring him on board to help us do more surgeries. in all of this. And Dr. Corley, bringing great prayers and great vibrational energy to all of us. And again, Dr. Chang, all of our docs and practitioners, just say, would you mind praying with us for a moment? Even if you want to lead a momentary prayer, bring our energy together. Healthcare providers bring God's energy to this planet and to this world, but we all work together, and we need you on this journey. Keto this time around, FET transfer, more successful, positive this time. In fact, this time, less time prepping and better response. I know kiltz's keto works. It's crazy. And the more kiltz's keto concepts we bring to the table, and listen, there are lots of recipes out there. I'm the boring guy. Bacon, eggs, butter, beef, ice cream, intermittent feasting, and salt. Now, I'm salt and water, but not too much of anything. But it is a crazy, crazy concept. Boring is the best way to a baby, by the way. And variety and spice is deadly. After 3 ml of PIO to start my cycle, can I expect CD1 so we can do an FET? Breast lick, get an ultrasound and blood work. My team, ultrasound and blood work. Add estrogen and progesterone from 7 to 10 days and Lupron. That's another way to get it going. But you don't have to have a period to start any cycle. Get baseline ultrasound and blood work. I'm going to be working with our team to help them and us all learn better on the way. Phyllis Davenport, hello. Weight limit for IVF or reversals. The reversals are a little more challenging, but not the IVF, by the way. Light sedation. And we all have to be looking and recognizing each human being, size, shape, age, weight, gender description, relation description, color description, cultural description. We're all human beings on this journey of helping each and every one of us heal and build a family. And we're all part of the family. You know, it's too much of Western medicine is like, I know what you should do, and don't argue with me or don't tell me. We're family. We're all listening and learning and working together. Modified natural drawbacks. No, they're all possibilities. Do a natural, do a modified natural. Do it for IVF and an egg retrieval, by the way. Do a no meds, do a trigger shot, either do a transfer or retrieval or intercourse or IUI with all of those things. Add some letrozole or Clomid trigger shot and add any of those, or add some low-dose injectables with that, by the way. Pcos, sorry about that, age 44 years young. Recommend any specific vitamins. Molecular fertility, male and female. Get those. Our ovarian bloom for sure. DHEA. It's reported out there that DHEA may help your fertility. Somehow someone has patented that fact, but I think it's been known for a long time. So add DHEA, and it may help. I don't know how long or how much, but you could Google it and learn about it, right? Natural FET, yes. Ginger's girl. Dr. Magarelli, Fink, Corley, Lutheringer, Kondrup, all of our docs and practitioners. I would like to do the natural cycle FET. We can do it. I would like to do a medicated. We can do it. These are all things. I'd like to bring my sister as a donor, my brother to be a sperm donor. What do we need to do that? We can do these things, by the way. Be open to tell us what you need and want, and we're going to do it. Dr. Magarelli, Dr. Fink, Dr. Kiltz, Corley, Lutheringer, Kondrup, Verdialis, Ivanov, Dipkov, Grossman, and I'm missing some in there, and I apologize. Practitioners, by the way, all of us together, and our nursing team, RNs, LPNs, MAs, all of them together are helping you on this journey. Plus, we do infusions, IVIG, intralipids. We're even going to be adding vitamin infusions and just fluid infusions that can really help. And don't forget, high volume PRP, thank you to Dr. Verdialis. Intrauterine can help flush out the tubes, flush out all that stuff that may be a factor. Even saline infusions can help and clear out the uterus, clear out the tubes, reduce the inflammation, just like saline nasal infusions may help reduce your risk of COVID. That's why masking is protection, depending on your risk. Sherlyn, how are you doing today? Karen Michelle Miller, to shed lining more and recommend Lupron, but how long do you stay on it? Once, stay on either Orlis or Lupron until you start your progesterone for your transfer. So if my team says, oh, you could stop your Lupron, you got your period, stay on Lupron or Oralissa until you start your progesterone. That'll help keep you quiet. So, hey, I don't get my periods. I have a thick lining. Lupron, estrase prometrium, stay on the Lupron, 10 units, or the Oralissa, 200. It can really be helpful, by the way. Are all vitamin supplements safe to take after transfer? The molecular, are all vitamins? Well, that's a global statement. No one knows that answer, but the vitamins you're on are likely safe to stay on when you're pregnant and throughout your pregnancy. We recommend the molecular fertility, male and female. And don't forget, kiltz is keto, kiltz is keto, kiltz is keto. And it's like, wait a minute. I know I'm an upside down guy, but check out the new keto lifestyle for fertility. And again, as a vegan vegetarian, it's simply cook the carbs well, simplify them, add either coconut oil, hemp seed oil, butter or cream, and one meal, by the way. Thank you guys for all the love and the sharing and the likes and the subscribing and all those things. We're all learning to be and do better every single day. And do we make mistakes? Yes, we're human beings, never intentional. We're listening and learning. And we all can do better. Let's see. Dr. Vidali, he's the guy. We love him. Can endo come back from all the hormones? Yes. Gigi 5. That's why we often recommend stay on kiltz's keto lifestyle. Really a game changer. Probiotics, Sunset Silva. I don't recommend probiotics. My bias is that it's the glycobiome that's more important, and the sugars are damaging. But there are some lines, and we're going to be looking at it and coming out with a line of probiotics. I think that could be helpful. Kiltz's keto lifestyle and the probiotics may be the game changer. A high ALT, could that be from keto? ALT is from a damaged liver. It's just not from keto. It's from a lack of keto, but you still maybe the label keto is all over the place. For me, plants are the predators and deadly. So it's a crazy concept. Let's see. Carissa Curry. How you doing, Carissa? 0.16 is before you start progesterone. All right. Zero motility ever increase, and with what treatment? So low to no sperm, no motility. Absolutely. The male molecular fertility, kiltz's keto lifestyle for fertility is a game changer, in my opinion. Diet does matter for sure, but look at Clomid or HCG or even letrozole supplements, even testosterone. If you're taking HCG supplements, you can't just take testosterone because it'll suppress it. And get off the treadmill. Cool the body. The miracle machine. Remember, the body, your body is the miracle machine. And that's the game changer here. Let's see. Bridal Biz Beauty. I don't have a preference day 3. So cleavage stage 2, 3, or 4, or blast stage 5, 6, or 7. We transferred all of those stages, by the way. Let's see. If my BMI is 19, should I do keto? Everyone should do keto because keto is anti-inflammatory and it's a high fat. If you're losing too much weight, you're getting below some ideal body weight, then add more fat, eat more fat, and check out Kiltz's ice cream, a game changer, in my opinion. And we'll be doing more videos on cooking, on carnivore, on vegan, vegetarian, and Mediterranean, and pescatarian, all of those to come in 2022. Excited about it. We have a great, amazing team. My daughter Pilar is working on the team and helping our blue ocean to help on the financial, to make it more organized, answer your questions, get you guys moving forward. And Miss Tia takes great, amazing care of me. Can you imagine? I'm a handful to take care of. Current clinic for CNY for treatment. My insurance doesn't cover full treatment. Ash Bubble app will take care of you wherever you're at, wherever you've been going. And we have patients that come to us and go other places. There are many great fertility clinics out there. Absolutely here for you guys to help build this, no matter what country, what gender description, no matter what culture, no matter what diet you're on. We are here to help you. You don't have to do kiltz keto. You don't have to be a carnivore or vegan. You can be who you are, and we're here to help you and give you guidance and ideas to work with what you want to do, whether it's fresh or frozen, whether it's a cleavage or a blast stage, where it's a full immune or neuroimmune, whether you choose to do a laparoscopy, hysteroscopy or not. We're here to help you on the journey, by the way. Kathleen Mayfield, does having one fallopian tube decrease your chance of getting pregnant naturally? If the one is good, excellent, and removing a bad tube and leaving a good tube will increase your probability. We often do removal of hydrosalpinx in order to improve people's natural chances. Our job is natural. Anything we can do to help improve your natural chance, that's what we want to be doing on this journey. Allowed to transfer at any one time, Jamie Stewart Melendez. We recommend 1, occasionally 2, rarely 3, almost never 4. Now, these are individually determined by the team. You know, we have guidelines and guidance, but we got to not be the government, not be the Gestapo. We're working with you on this journey. That I know. From Alaska, Dr. Cook, great. We'll work with your doctors wherever they are. Talk to your OBGYN in Southern California, in Minnesota, in Wisconsin, in Louisiana. Ask your OBGYN doctor, will you work with Dr. Kiltz's team at Fertility to do my monitoring, help me with get my blood work, either LabCorp or Quest, wherever you're going. We're here to help you and guide you and build your success. Tam Curry, Royalty Cleaning Service. Hi, how are you doing? It's a thank you to everyone and love to everyone. The Zero Vital, Sarah Vital. Sarah Vital is basically a human growth hormone supplement. Sarah Vital, Somaderm, and Omnitrope. And how it helps, I don't really know the answers, but there's some evidence. But using human growth hormone, even for guys, by the way, and adding that can be very helpful, by the way. It helps, I think, in building better eggs, better sperm, better environment, better lining, and reduces inflammation. Dr. Patel, awesome, in Orlando. Thank you, Dr. Patel. And again, we're working with your OBGYNs, your fertility doctors, that we can all integrate and work as a team, a family. I'm a member of SART and ASRM and the American College of OBGYN. We are physicians, healthcare practitioners that are supposed to be working together. And if your ideas are different, let's all listen to them. We're a family together. And the more we can work on that, the better. Alyssa Biviano, Fragile X, we'll do the testing. I think we're overblowing Fragile X, but if PGS testing or genetic testing is necessary, we'll help you on that journey. It might require donor eggs or donor sperm or donor embryo, but we'll work with you, by the way. Plaquenil, Plaquenil, Lindsay. Plaquenil is an anti-inflammatory. It's used for arthritis. It's used for malaria. It's been around. It's even been touted for COVID. Remember, COVID kills us because we have a high inflammatory environment due to a high carb diet, cereals, protein bars, shakes, smoothies, vegetables, seeds and nuts are all sugar. It candy coats all of our glycocalyx and damages all of our cells. It has most damage in the vessels, the microvascular system. It's a game changer. And I know most people don't believe it. They want to see the science. They're waiting for the randomized studies to prove something. My friends, you're going to be waiting and waiting and waiting, because do you know how slow this Western medical science, and there's a lot of political agendas if you haven't figured that out, and money is the master, and we want to step away from the need for money and the need for the master herself, himself, us self, and God and the Spirit is with all of us, right? And I think they call that, may the force be with you. Let's see, Nicole Book, it's my pleasure. Getting, let's see, looks kind of pricey at Amazon. Look at, again, we are working on maybe bringing out our own Serovital or HGH or supplement. I'm working with Will and Jeremy and helping with that for sure. But yeah, some of these things are pricey. What's the most affordable and simplest thing you can do? I know I'm a broken record. Kiltz is keto for fertility. And check out the Fertile Feast. And these ideas are radical. I too didn't believe it. One meal at night, intermittent feasting is what I call it. Kiltz is keto lifestyle. One meal at night, OMAD at night, right? And add the fat, bacon grease, cream, butter, coconut oil, a game changer, hemp seed oil, and slow it down. So infinite prayer and meditation of what you desire and dream about. And don't forget, why do I put love up there? Because love emulates to the vision of what we think about. And we know there are hardships in life, because life is a struggle and a stress, but that strengthens all of us. That's the cross of life. The crossroads require some struggling and stress, and know that God is behind all of this. Man, let's see. Last baseline progesterone is 0.16. Baseline, yes, that's good, Doriana. Let's see. Kaylin, Costco has it too. I don't think it's pricey. Yes, look around, get better pricing. Share it on the cnyfertility YouTube, Facebook, TikTok, Instagram sites. We're about sharing. Check out Aaron McCullough's Fertile Hope Yoga, Danielle Baratella's the Fertile Spirit, and check out my book, The Fertile Secret. What's the secret? If you haven't read Rhonda Byrne's book, The Secret, and that's how I got the idea of the Fertile Secret. The secret is what you believe in comes true. If you believe it's hard, it'll never happen, life isn't fair, oh my gosh, this is terrible, well, that's what you live. But if you live, oh my God, this hard stuff is so beautiful and I love it, fake it till you make it. I know it sounds crazy. All embryos are rest at day 3, both retrievals, 22 eggs each, and only 8 mature. Day 3, do not go to blast. This is where you might trigger, make sure you add HCG and Lupron. Add a little human growth if you weren't on it. Some people know human growth. Low dose protocols, 10-220. Dr. Meggs, 10-220. Dr. Chang, 10-220. Dr. Corley, 10-220. Dr. Kiltz, 10-220. What is it? Ask the team. Lower the dose. Amy, Martha, all of my team members, 10-220. Let's see. My tubes are tied and burned. Is IVF a good idea? Mrs. Geyer, yes. 92518. It is a good IVF. And sometimes, by the way, tied and burned can be reversed. We do it laparoscopically. It can be done. Between gonal F versus Follistim, Cetrotide versus Ganirelix, I think that they're essentially the same. But if you have a latex, I can't remember which one, but one of these Cetrotide Ganirelix has a little latex, so you got to be careful. But I think either one is good. Thank you to Metro. Thank you to Integrity. Thank you to all our pharmacists, Noble, CVS, thanks to Optum, United Healthcare. Really, all the players in this are working together. But check out the pricing before you pay the bill, and look around and get the very best price you can, by the way. 2 different grade embryos, one fair, one poor. Sabona Core. Yes, you can. Stop grading. Judge all embryos. Humans with love, no matter size, shape, age, weight, gender description. All of us have to stop the negative judgment. Doctors, please stop it. All of us need to be judging with love, each and every one of us, because this is a God created journey. And God is all love, and love is all God, and it's within all of us. And at Fertility, we want to sprinkle the love and baby dust every day. Silvana, Kiana, over the counter. Again, the Ceravital and Somaderm are over the counter. The Omnitrope is a prescription. So hydrosalpinate removed in one tube, but husband has low sperm count. If you remove the bad tube and look at the molecular fertility male and female supplements, look at Kiltz's Keto Lifestyle for Fertility, look at Maria Emmerich and Craig Emmerich stuff on carnivore and standard stuff. We're all working together. Oh, Judy Cho, Carnivore Cavelli, so many out there sharing the way. What's the impact on high fat to the liver? High protein and high sugar is deadly. High fat does not go to the liver. It goes to the lymphatics. Liver overload is caused by sugar, vegetables, fruit, fiber, seeds, and nuts, my friends. And plants contain estrogen, progesterone, and testosterone to cause you to be infertile, because they do not want to be eaten, my friend. They are the predators and we're the prey. The damage to the liver is not due to fat. It's due to mostly a sugar protein diet. That's our killer. And people don't get it. But the job of the liver is to make fat. So liver gets the blame because all sugar, all protein is converted to fat in the liver and all over our body. Because if you're not fat and there's a famine, you're dead. That's the stupid, most amazing concept ever have I learned. Let's see. Amenorrhea obviously mean no estrogen, so it would trigger endometriosis recurring. Endometriosis is inflammation. The cause is not estrogen. The cause is inflammation. We eat a high inflammatory diet, high estrogen, progesterone diet, and the colon gets inflamed. It sits next to the ovaries, uterus, tubes, and the pelvis. It causes inflammation that causes all of our problems, by the way. Again, these are really crazy, game-changing ideas that I will bet $1 billion that if you simply recognize that we are lionesses and lions, not pigs and cows, not grazing animals. You choose how you want to eat, but again, one meal at night, high fat, cook the carbs well or eliminate them, and you will feel more amazing than ever and get off the treadmill of any significance. Light weights. I've been doing a little bit of light weights, a little bit of I used to love to ride around the lake in skinny atlas, a crazy man, but now at 65 and a half, I do a little bit. And I work to keep mostly, if I limit the food I eat to Kiltz's carnivore keto, I feel the very best. All right. And again, you vegans, vegetarians, we honor, we support you. You do not have to do Kiltz's keto. All right. Or the carnivore Kiltz's keto. Let's see. Mit Huntia. I hope I got that right. Tanya. PCOS, both ovaries have cysts. Right ovary is 11. Cysts are okay. IUI, can I get pregnant with PCOS? Absolutely. Plenty of women have PCOS, get pregnant, never see a fertility doctor. Letrozole trigger. Don't forget low-dose steroid. Don't forget low-dose naltrexone. Don't forget the omega-3 fatty acids, the molecular for fertility, male and female supplements, one for the male guy, for the sperm source, the egg source. And I think they really, really do help, by the way. Let's see. Can CY send medical necessity letter to Novartis that we recommend? Need a letter from a doctor. It doesn't have to be for FDA approval reasons. Yeah, we can get you a letter. We recommend HGH for your fertility for sure. So let's see. Cecily Walker. Hello. Outside of the uterus. So fibroids, it can be anywhere in the body, but we're talking about uterine fibroids, whether they're on the outside of the uterus, the inside, the muscle, or inside the cavity. All of those are indications of inflammation. I recommend remove them in many, many cases. So if it's not working what you're doing, either intercourse, IUI, IVF, fresh or frozen, your egg embryos or donor egg embryos, it doesn't matter. If it's not working, talk to a laparoscopist or a pelvic surgeon, either through a mini lap or a lap, whatever it is, or robotic or not. I do all these straight stick laparoscopy. I'm the robot, and I think it works really, really, really well. I've seen so many women where you remove fibroids, they get pregnant, deliver a baby. And if you have a myomectomy, you almost surely need a cesarean section. Don't let your doctors talk you out of that, because I've seen too many people suffer because they failed to get their cesarean section. 6 good eggs and only 1 was retrieved. 6 follicles, 1 egg. That's where we have to look back and understand. Let's see, Teresa, email me rkiltz@cnyfertility or text me 315-416-9872. I'll see if I can get you in sooner. We're really working on Dr. Fink and Dr. Banerjee and Dr. Magarelli. Open up your schedules, add more people. We have to fill our schedules because people are waiting too long to get in to talk to one of you guys, of us, to get ideas how to be better. That's the answer. What is a safe way to quit smoking without causing too much stress on my body? So the first thing is, don't buy them. If they're in the house, throw them away. I stopped coffee for 6 months. I do 1 cup now, a little bit, but you might try Chantrix or whatever the gum is to get out. It's the smoking that is the worst. Certainly too much nicotine or caffeine. Nicotine, by the way, is a toxin. It was used as a pesticide. And that's why plants make it. It's a pesticide to kill the pests. Plants make the pesticides. If we drink them, smoke them, inject them, it's not good for us. So it's the best way is throw them all out, stop buying them, and say to yourself, I am a non-smoker. I am a non-smoker. Why would I put something in my body that's killing my eggs, sperm, and embryos, or it's killing me? Remember, you're the temple. You're the most valuable, expensive, irreplaceable entity. No matter what size, shape, age, weight, gender, color, culture, it doesn't matter. The seed of life is you, and you're working to create another one. Don't give up. Cecily Walker, yes, just tell them you want an appointment with Dr. Kiltz. I'll be glad to. And listen, if you guys want to do a video conference with any one of us, we'll do that. So much efficiency is simply just talking again, but we want what you want. And if you want to, hey, I would like to have a video conference with the practitioner, or I'm willing just to talk. Tell us what you need or want. We'll get that for you. And we'll work with your OB/GYN, your fertility doctor. Just also get the family building guide and share it with your docs and try these new things. And we all need to be open to much new, different concepts and ideas. It's a game changer, right? Dr. Randy Morris in Chicago area. Awesome, learning lots of great things. Check out his TV channel, by the way. Let's see, low testosterone. So as you're all, just put him on Clomid. Let's see, but the count didn't increase. This is where you might add HCG for sure. And I recommend HCG 250 units a day, Clomid 25 a day, or letrozole 2.5 with HCG. And don't forget, Kiltz's keto lifestyle for men and women, egg source, sperm source. Check out the molecular fertility and low-dose naltrexone for guys, and get off the treadmill. Slow it down, cool it down. And I know the fireside chats, I've got the door open. In upstate New York, it rarely is 90 degrees. We're all learning together. Oh, Kiltz's cups. I'm working on getting more of them out there. It's my relaxation, something I can do. I've been doing it for 50 years. And Mrs. Wong taught me back in high school at John Marshall High School in Silver Lake in Los Angeles. And find some activity, whether it's knitting or writing or listening and painting. You are the artist of life. If someone says something different, you are the artist. You are extremely talented, and talent is built into all of us, by the way. Let's see, Paola Giannotti. It's opening very soon. It should have been a week ago or 2 weeks ago. So hopefully it'll be coming up. Just because of COVID craziness, to get things delivered takes time. Snyder said, I have a septate uterus, Siri Bam Bam Tribble. We need to look at that. If you have a septum in your uterus, that may be a factor for fertility. Maybe add a hysteroscopy at retrieval and make sure we get a look at that before you do a transfer. Do a freeze-all cycle and then come back. Zarixio, a good substitute for Neupogen. It may be, but the doses may be different. So if your insurance covers it, we'll work with our team. We're sometimes very narrow. We can write lots of Neupogen or lots of Omnitrope, but if you want to venture out to something new and different, it gets challenging for us. Thanks to Donna and the global team, to Justine, to Kristen and Angela and Sharon, all team members on all sides. We're really working to do better. We need to add more team members in order to give you better. What are they going to discuss during the consultation? Well, we're going to get an idea of what things are going on in your body and your partner and why you are infertile, what's been going on. And then we'll give you and discuss some of the ideas. And that's where, if you look at the family building guide, download it, go to our cnyfertility website and go to the resources page. You can get all your pre-testing done, have it in the system, upload it. And we're working on a new website that we can do a lot of this work, make it easier for you. And then our chart work is in Ivf. So we're excited about that. Lisa Palmer, I don't recommend PGT testing for anyone unless you have a known genetic disorder. And we're working to not do the transfer of whatever that genetic disorder is. So again, but we work with Cooper Genomics. If you want it, we offer it. We still have affordability, quality, and access for you in this journey, by the way. What does HCG do to help sperm count? HCG, Christy Polasek. HCG stimulates the sperm supportive cells to make testosterone and stimulating sperm production quality and numbers. But it works in some people and doesn't work in others. We don't know why it works and why it does work. Don't forget acupuncture, massage, meditation, prayer, and visualize. Let's see. Foamy urine without presence of proteins. Well, I don't know that answer, but my bet is it's something you're eating that's getting it. And I don't know if it's harmful or helpful. Very good one, by the way. Cause of, let's see, John, again, I'm not sure on that one. How does I remove one tube? What size you recommend to trigger? Anywhere between 16 and 18 and sometimes up to 20. I don't typically go above 20, but some might be above 20, some in order to get the majority above 16. So it's not always exact. KL Emerson, hello. Let's see. Sue Owell, hello again. Let's see. Does trigger shot cause multiples? Well, trigger shots causes the release of the eggs. And if you have multiple eggs, you can get multiples. But if you don't trigger, you might not ovulate. And again, that's the game changer. IVF increased chance of having another ectopic pregnancy. Just had an ectopic tube ruptured, severe internal bleeding. Oh my gosh, Jenna, I'm so sorry about that. So IVF has a risk of ectopics, just like intercourse and IUI, fresh and frozens, all of them do. So be aware of that. If your HCG is not rising right, or you don't see a pregnancy in the uterus, then be aware it might be related to an ectopic. The Factor meal service, all keto. I haven't, but again, those meal services are great. I personally recommend that one meal at night. And look at our stuff on our Kiltz's Keto Lifestyle and the meal services. I keep it simple. I only have eggs and steak and cream, and I love Parmesan Reggiano. And I keep it really, really simple. So don't make it too complicated. Again, so many people don't do dairy in keto, by the way. If your milk is for babies, butter, cream is the only stuff I have in my keto. And if you're sensitive, don't do it. But if you look at like Parmesan cheese, over time, lactose is broken down to a simple amino acids, and so you shouldn't have a problem. So I think that's the game changer. Is raw milk okay with an egg while doing IVF? I don't know that answer. I'm not a milk fan. I'm a cream or butter fan. I think in milk there's too much antigens and too much lactose that isn't good. We can fix septate uterus, by the way, and sometimes we can even fix it at retrieval. So if you come to Syracuse, I can fix it during retrieval for sure. Thank you everyone for joining me, by the way. 11:05. I'm going to mix it up some afternoons and some evening lives. Dr. Fink will be joining us on doing some lives coming up. Excited about that. Don't forget Dr. Verdial's doing lives, Dr. Mag's doing lives, all of this. And I'm not sure. Yes, Dr. Walensky can do the fix of the septum in Colorado, but not at retrieval. We'll work with your OBGYN doctor on that also, Sari. PCOS, non-existent menstrual cycles. Can I plan our IVF by birth control? Again, yes, you can, Caitlin. You don't even need the birth control pill. If you get a baseline ultrasound, you have a thin lining, you could trigger any time pretty much. But yes, you could do the birth control pill. I don't love it. I'm a big fan of estrase and prometrium. Wheels go round now. Thank you very much. I enjoy all of everyone's enthusiasm, and enthusiasm is the spark of life, and we should all be bringing it to our days. And remember, who's in charge of what's thinking in that brain of yours? You are. Change your thoughts, change your mind, change the dream, and hold on to the dream of building a family. God bless to each and every one of you out there. And I love you guys. I'll see you next Sunday. It might be 8 o'clock at night. It might be 10 in the morning. Not sure yet. But I'll see you guys. Take care to everyone. Love you. Bye, guys. Thanks for joining.